we kind of came into it when we had known that it was originally a corneal laser. So the original specs on the original Femtech laser were to cut corneas. So then when I can have something where I have both a LASIK and a cataract practice, it really fit us perfectly. And sure enough, when we had the opportunity to cut some of the first flaps in the US and the first cataract laser surgery, we knew that it would be a perfect mix for our patient population. You know, I think like any new laser, when we had first started, there was an original suction ring that worked very well but had just a little bit of chance of patient eye movement. And now in the last several years with the new suction ring, and it's made a world of difference where both our flaps and our cataract surgery are just seamless. Well, like any femto laser, there's always a little difference in both your flap cutting and when you're doing laser cataract surgery and some of your original techniques. You know you're going to have the accurate cuts, but in cataract surgery you learn how to move the bubbles and you learn how to budget your time best in the surgery center. But the results for the patient are so worth it that the doctors can't wait to sort of show this to the patient and bring it into your community. One of the things other doctors have come to me about and concerns in adopting femtosecond technology is how is this going to work with my flow at my surgery center? And we've actually built our surgery center around the flow of the femtosecond laser, and it works wonderfully. Some patients that choose traditional, they can be in one room while I'm doing the femtosecond laser on an upgraded patient, that then I move sort of seamlessly between one OR and the other. And I wouldn't say it's not only not slowed us down, the flow has been that much more natural for our nursing staff, and the patients haven't noticed one skip a beat. So when you come to choices for all the technology that's out there, you have to see what's going to adapt to your practice very well. An important reason why femtosecond technology needs to be considered is the patients are now very educated. They know about laser cataract surgery. Of course, they thought they were originally having it, but when they ask you, we're doing laser on this, right, and the doctor doesn't have that, they need to be sort of prepared as to what their answer may be, and their answer needs to be, well, I want to deliver the most accurate and reproducible result I can. And you can be the best artist in the world, and you try to doodle a perfect circle, but the laser says how big and where do you want it. So that's kind of the reproducibility that your practice wants to deliver to the patients. And you need to be able to talk to your staff and say, here's why we're excited about this technology, and here's how we're all going to be educated together so we can deliver a consistent message to the patient. And that's going to get it off the ground faster. And when your patients see the results, fantastic. But when your staff sees the results, they get as excited as you are because they know they're delivering what you promised.